Hello, Doctor Sebas here from RMI. I am currently working and developing different treatment protocols for anti-aging medicine, longevity, and also for chronic debilitating diseases. And I'm here to help you answer a very simple question that you may be suffering. Do you suffer from chronic fatigue syndrome or long COVID? So I'm going to enumerate a couple of questions for you to see if any of these apply to you. Do you ever feel like you're extremely fatigued? That when you go to rest, you're not able to recover from that fatigue? That you're not able to do things that you once enjoyed? Or that you just feel random pains around your body? Even you may have trouble concentrating, or what we call right now brain fog. After all of this, you go to your physician, they tell you everything's fine, and your results are coming back normal. And they may recommend to you for you to lose weight, maybe exercise more, or even do yoga, meditate, other types of treatments that may not really apply to you. Pretty much you feel like you're invisible. So they're not giving you answers, they're not resolving your issues, and you're just not happy with the treatment that you're getting. So if your answer was yes to most of these questions, you may be suffering from chronic fatigue syndrome or long COVID. Chronic fatigue syndrome is a long-term illness, and it's also debilitating that has shown to cause extreme tiredness and also just in general not being able to recover from it. Now, this has been shown a really bright spotlight with the COVID pandemic, since we now know that it follows in the wake of infections of different viral diseases such as dengue virus, Epstein-Barr, cytomegalovirus. We can also have it after COVID, which is one of the bright spotlights right now, and also with other SARS coronaviruses as well. This is one of the reasons why there is such a strong relationship between chronic fatigue syndrome and long COVID nowadays. This disease is not usually taken seriously by societies, families, or even healthcare. In the case of chronic fatigue syndrome, 1 to 8 of 1,000 Americans may suffer from this disease, and about 17.6% of the USA population may suffer from long COVID consequences as well. Pretty much anyone can get this disease and their quality of life is going to be really decreased. Now, to know if you have chronic fatigue syndrome, you must have these 3 following symptoms. So the first symptom is going to be the inability to participate in your typical daily activities. Now, this is going to last for at least 6 months and is accompanied by fatigue. This fatigue is going to have several characteristics, which is that it's going to be really serious, it's going to happen as something new, not just tiredness in general, and it's also not going to be alleviated by rest. The second symptom is going to be post-exertional malaise, or PEM, which is pretty much that once you do either an emotional, physical, or any other type of exertion, that's going to cause a worsening of the symptoms, and it often leads to relapse and really worsening of the condition in general. The third symptom is going to be unrefreshing sleep that can be noticed by 2 different ways. Either you have trouble going to bed, or you pretty much wake up feeling as if you never went to bed at all. Additionally, you need to have at least one of the following symptoms as well, which are going to be the brain fog or difficulty concentrating, or you can also have orthostatic intolerance, or that you have trouble when standing up, or you feel like you're going to faint. If you check for those first 3 symptoms and you have either one of those of the last 2, then you may have chronic fatigue syndrome. How to know if I have long COVID? Long COVID is going to be characterized by a series of symptoms and illnesses that developed after 12 weeks after the initial infection. Now, the main characteristic is that they're going to interfere with your daily activities, or that you're not able to do what you would typically do on a day-to-day basis. However, these symptoms and this illness cannot be explained by any other more likely or alternative diagnosis as well. Some of the most frequent symptoms that you may encounter on long COVID are fever, chest pains, shortness of breath, brain fog, trouble sleeping, and many others, but that are not even limited to these ones. Now, there is no specific test for long COVID or chronic fatigue syndrome. It is based on excluding the different other diagnoses that may explain the symptoms, such as gastrointestinal diseases, hematologic, neurological, endocrine, and many others. It is also necessary to do extensive blood work and diagnostic imaging to be able to exclude all of the other possible diagnoses as well. You have chronic fatigue syndrome or long COVID, so now what? You have tried novelty drugs, you may have tried your grandma's secret recipe, or a lot of different things found on the internet, or even scam treatments such as graded exercise. You can also have done cognitive behavioral therapy, but you really haven't noticed any benefits or anything that's actually working. It's possible that you may feel that you're running out of options. In RMI, we have developed the ViVA treatment, which is an evidence-based approach towards managing and improving the symptoms of chronic fatigue syndrome and long COVID. Some of the potential benefits of this treatment are going to be a reduction in pain and fatigue, an improvement in exercise tolerance, a reduction in brain fog, improved neurovascular symptoms, and enhanced sleep quality. If this treatment could help you, schedule a consultation today. Don't lose hope. We want to help you reclaim what's yours.